Hello, my name is Yasmin Kaiser, and I'm a registered nurse working in acute rehabilitation at Methodist Hospital. And today I will be presenting my Capstone portfolio focused on the lack of mental health resources in Nebraska. What if help isn't available when you need it the most? Mental health access is a growing concern in Nebraska, particularly for vulnerable populations who experience barriers such as limited providers, stigma, and lack of resources. In Nebraska, there are significant gaps in mental health services, which include provider shortages, especially in rural areas, long wait times for care, and ongoing stigma surrounding mental health treatment. One experience that helped me grow as an effective communicator involved caring for a patient experiencing anxiety and depression during their rehabilitation stay. In another experience, I worked closely with an interdisciplinary team to coordinate care for patients with complex needs, including mental health concerns. One situation that actually impacted my development as a reflective individual was recognizing that a patient's mental health needs were not initially prioritized due to their physical condition. Another important learning experience involved understanding the impact of social determinants of health. I learned that factors such as income, transportation, and stigmas significantly influence access to mental health services. This directly relates to Nebraska, where rural populations and underserved communities face additional barriers. This reflection has strengthened my commitment to advocating for equitable access to mental health care. As part of my development as a change agent, I participated in a fall prevention project where I identified risks and implemented safety interventions to improve patient safety. Through this experience, I also learned that meaningful change requires planning, collaboration, and leadership. I can apply these same principles to mental health initiatives by supporting preventative strategies and system improvements that address the root cause. I also explored mental health gaps in Nebraska through research and coursework. I identified key issues such as limited access, workforce shortages, and funding challenges. From this, I learned that effective change requires both awareness and action. I plan to advocate for solutions such as expanding telehealth services, increasing funding, and supporting programs like mobile crisis units to improve access. My portfolio included 12 reflections that demonstrate my growth throughout the RN to BSN program. Level 3 reflections focused on foundation learning, including communication and self-awareness. Level 4 focused on applying these skills through leadership and advocacy. Together, these reflections show my progression from learning concepts to actively applying them in my practice as a nurse. The key themes throughout my portfolio include advocacy, leadership, communication, and equity. These themes are interconnected and have shaped my development as a nurse. They also directly support my ability to address mental health disparities and improve patient outcomes. In conclusion, this program has strengthened my ability to communicate effectively, reflect critically, and act as a change agent. These skills have prepared me to advocate for improved mental health resources and provide more equitable care. Moving forward, I am committed to continuing this work as both a nurse and future simulator educator. These are my references that I have used throughout my presentation. Thank you.